Welcome back to ASBM in clinic, Shadowing with Masters. Today, again, we're going to be we're continuing our gynecology module here. And today we're going to look at infertility, which will be hopefully a bit of a focus throughout this module. And so today we'll be talking about the cases of Lou Shao-kun, a little bit of his perspective on looking at infertility. So first, a little bit of an introduction to Lou Shao-kun. Um, he just passed away actually this past year, and was born in 1944. He's interesting because he's primarily self-taught. He reads a lot. He's a voracious reader. And interestingly, for a little context, he's very respected by Huang Huang. When when Lou Shao-kun passed away last year, Huang Huang wrote a long obituary, sort of mourning his loss and talking about his contribution to Chinese medicine in China and also to jingfang. In particular, he is, jingfang kind of guy all the way. But he's deeply influenced by the Kampo tradition. I would say probably more than just about any other practitioner that I've ever come across in China. He was fluent in Japanese, and he just reads voraciously from the Kampo tradition. He's read everything.
Can I just ask a question?
Yeah.
In terms of Campo,
Mm.
does he kind of like go back to like the beginnings, like Toro Yoshimasu and up to kind of like Dr. Okatsu and things like that? Or does he tend to focus more on the modern guys? Do you have
Definitely he's
any?
read everything. Yeah, I mean he definitely he's read from the very beginning of the Koho or the Gufang, sort of like the classical lineage in Kampo, starting with maybe with Yoshimas. And so yeah, he's deeply embedded in that stuff. And so as a result, as you can imagine, he is really a very strong formula pattern correspondence kind of guy. Now, the sort of, I would say the focus for Lou Shao-kun, or one of the focuses, is abdominal palpation. So you can see there in one of the pictures there, he's doing a little demonstration about abdominal palpation. And he talks about that a lot in his books. Very much informs practice. It'll inform these two cases, as you'll see. Um, and so why do I know so much about this guy? Because I just translated one of his books. I translated his case studies and medical treatises book.
Mm.
And it'll be coming out soon. So a little plug through Purple Cloud. I think it's a very good book. Like I say, it's probably one of the first books that I've read in terms of case studies, um, where all of the case studies have detailed discussion of abdominal patterns. So I thought that was quite nice. But in general, I really respect this guy. Um, and I've read his other books as well, and also think they're quite good.
Well,
So
can I
let's,
just say, just
yeah.
even when I went to see you last year, he was his. I
Mm.
mean, you already had his book. Even I think I hadn't even heard of him because I saw when I came to see you last year in April, you had his was it Yifang Yijian, right?
Yeah,
So
Yifang.
yeah, yeah. So you've been a fan of
Yeah.
his for a while and as well, haven't you?
Yeah, and I mean, I ended up getting into him when I was developing some course content for the Jingfang course. And yeah, it's a big part of that as well because he has a lot of very specific insights, as you'll see, on formula pattern. He's sort of developed his own insights. So it's pretty nice reference. So in terms of his philosophy on infertility, it's very much informed by this ideology of formula pattern correspondence. So, just basic thing talking about six conformation. This is this comes from his book. He says it's a patient-focused clinical system, as opposed to a disease-focused system, guided by
Mm.
yin-yang theory. Yin-yang theory is used to elucidate changes to the pathological state of the body in varying stages of disease as opposed to focusing on etiologies or sites of disease. This approach focuses on the current pathological picture in a dynamic unfolding process, right? So he's very much opposed to saying, okay, infertility, that means it's thoroughfare channel, and giving this analysis that's based upon the disease itself. He thinks it should be based upon the state of the patient uh, in the clinic as you see them. So what he says is physicians often fail at treating infertility because they only focus on the local sites of dysfunction in the organ, bowels, and channels. They only look for etiologies in the thoroughfare, conception vessel, liver, and kidney, and neglect to seek an understanding of the holistic nature of the disease in terms of the six conformations. So I think this really opens up a lot of possibilities in treatment when you espouse this kind of philosophy. Obviously, sometimes it's also a bit scary or a bit intimidating to just say, all right, you have infertility, you came in for infertility, and I'm just going to completely treat your pattern, right? But that's what he's going to try to do. So we'll see some of his approaches here, but by no means the limits of his approaches. And that's one thing I like about the book. He actually shares, I think, 9 cases on treating infertility, and each one is a different formula pattern, so to speak. And so you get all these different looks at infertility treated from different perspectives. So he does that with a few diseases in the book, and I think that's pretty nice. So the first case is both are infertility, and this is infertility but with menstrual diarrhea. So this is Miss Lee, 32 years old. This was a case from 1985. And it said the patient had been infertile for 5 years, um, potentially started following an abortion. The patient began having delayed menstruation with average volume, light color, and thin menses. She has a typical biphasic basal body temperature with stepwise mid-cycle temperature rise. Her cycle typically lasts 60 days with a 44 to 45 day follicular phase and an 8 to 9 day luteal phase. During her period, she has borborygmus and diarrhea, which resolves at the end of the period. So in terms of her current symptoms, she complains of stomach distension, glomus and fullness, stomach clamoring and eructation, sloppy and unformed stools, poor sleep quality, agitation, and frequent canker sores, right? So the pulse is wiry. The tongue is pale red with a thin yellow and grease coating. And in terms of abdominal palpation, there's a substernal hard glomus and a pain upon pressing at due 9. But continued massage at the point produces comfort in the substernum. So he massages at the due 9 point. And as he massages, a feeling of comfort starts to emerge in the substernum. So, for our students here, you can pause and already try to guess what the formula is, because it has some very clear signs there. I don't think I put it in front, right? So yeah, so he's going to diagnose this as stomach cold with intestinal heat. This is a mixed replete deficient Shaoyang glomus syndrome. Maybe gives it away a little bit more. And so he uses gancao, xie tang. And he uses, small dose. Lou Shao-kun, I talked to his daughter a fair amount in the making of this book. And I said, wow, your doses are pretty small a lot of the time. And she said, yeah, well, it's just a community clinic. We're not in a hospital or anything. So we're kind of on our own. So he said for that reason, he didn't, for the most part, doesn't use big doses. He does in certain cases. But
But
that's
just
why.
just to clarify, this isn't
Mm,
just like for patients who are in for infertility treatments. He just won't use like a low dosage for that. It's generally a low dosage across the board for most patients instead of.
right, yeah. He probably somewhere around like 呼吸 you know, 呼吸 a lot of the time his doses are not particularly high either.
Mhm, mhm.
That's it
Um,
for sure, Gao.
right. And that's the case with Lou Shao-kun as well. He has a
Mm,
very high dose of Shigao and Mufang Tang.
Can I
mm.
just ask a little bit
Mm.
about his dosages? It's interesting because he's kind of got like 10
Mm.
gram, 10 gram, 5 gram, 5 gram, then 3 gram, and then like a 10 gram. What is his kind of like liang to gram ratio? Is there a
That's like
consistent?
San Qian.
So 3 gram?
Yeah, that's 3 Qian.
Yeah, okay. Yeah.
That's essentially 3 Qian. And then I don't know why he's doing five of, but you know, that's
But
fairly common
yeah,
to
because it's kind of
do
got like
basically
five and
half
tens
of,
and
yeah, it's just like operating on basically like half. Um, but yeah, so you
it's
know,
kind of around three to kind of yeah, about
typically his gancao would probably be around five. If it was banxia xixing tang, his gancao would be five. So
mhm, mhm.
he more or less doubled gancao for this particular case. It's still not very high. But yeah, just in terms of the 比例, the ratio of verbs. Now, additionally, I advise her to have a family member massage do nine. So this is part of his special. He likes to do palpation on the back, and especially in um, Tang formulas, he's very interested in do nine. He's always using that as sort of basically a diagnostic tool to understand if there's a blockage basically in the substernum. That's the way he looks for it. And also he does that sort of massage to see if it will get better. When he massages, then he'll say, oh, then indeed there must be some kind of blockage. Now, at the second visit, the glomus was reduced, the menstrual diarrhea was diminished, and there was a slight abatement of pain upon pressing at do9. The stools were still slightly unformed. I continued using this
Can I
formula.
just ask, sorry?
Yeah,
In the second, does it say how long between the first and second visit, and if she had like a period, or when, like, because it says like the frequency was diminished, but it doesn't say how long, and because she was only having a period like once every, was it like 60 days or something like that?
yeah. So it must
She
have
got he got
come
15
just in
packets, right?
between.
He got,
Yeah,
yeah,
15 packets. Yeah. So that's a pretty long one for him to
yeah,
start out with 15. Um, yeah, so it just I guess it came in the middle.
yep, yep.
Um, and then the stools were slightly unformed. And so he said he just continued to use it with a reduced dose until July. It's amazing. It's still he's a little conservative with his dosages, but I'll tell you why in a second. I told the patient she could suspend treatment and monitor a condition. At the end of September, she was found to be pregnant
Mm.
during a gynecological exam. And so a lot of times I think he one thing I've noticed about his dosing is that he goes a little bit lower, but once he thinks he's found the correct formula pattern, oftentimes he sticks with it for quite a while. And he also, yeah, he'll stick with it for a while, especially in chronic disease. He's very adamant about being careful not to uh, just change your formula up too erratically when you're dealing with a chronic disease. If you think you have the correct formula pattern, just stay with it. Now, also
Does
part of
he,
that,
sorry, I
yeah,
was gonna say, does he then, is that kind of like, is he expecting to see little improvements as giving him kind of that feedback that he's on the correct formula? Or does he sometimes, even if he doesn't see someone necessarily improve, he still might say, I feel like this is still the right one and stick with it
yeah, typically he doesn't need to see improvement necessarily
straight
as long as
away?
he thinks it's the correct formula pattern. or sometimes he might see like a, a minxuan, like a healing crisis reaction as well.
Yeah.
But also he'll look, I think, for him, abdominal pattern is sort of like what pulse might be for other people. He's really feeling at each visit and seeing, okay, for instance, in this case, is the glomus improving?
Mhm.
Um, Glomus is uh, interesting because it's a subjective and an objective measure, right? Glomus is felt. It can be felt as a fullness or a discomfort in the substernum,
Mhm.
but it can also be felt as being sort of full in that area as well, or showing some sort of resistance as you push your hand down. And some people even say it can have pain, even though that's not technically part of the definition of glomus. So that's the first. These cases are pretty simple. But what we're going to do now is we're just going to look at some of his ideas about the Tang formula pattern, give you guys a little bit more of a sense of how to recognize that. I think he has really nice insights for most formula patterns. So we'll have a look. So to review, 干草泻心汤 um, it's basically 半夏泻心汤, but it has a larger dose of 甘草. And we saw that here, right? With the way he doses the formula. Now, in line 158, it says, after sustaining cold damage or wind strike, the physician purges the patient, after which they experience diarrhea up to 10 times per day, with undigested food, borborygmus, substernal glomus, hardness and fullness, and dry heaving and vexation. So again, you get the abdominal pattern right in there, and notably it says with hardness, right, and fullness, not just this substernal glomus. So really emphasizing the prominence of the substernal abdominal pattern in the formula, and also notably the diarrhea, right, because it comes up to 10 times per day. Now, I'll start by looking at Lou Shao-kun's 泻心汤 formula pattern breakdown. Then we'll look specifically at his 甘草 泻心汤 formula pattern. So this would be for essentially 半夏 泻心汤, 生姜 泻心汤, and 甘草 泻心汤. So of course the first thing is glomus and abdominal palpation, especially like we saw right in the line 158. We might get a slight hard feeling upon pressing, and it might be painful. But the very important thing to note is that in terms of Lou Shao-kun's experience, maybe at first as you feel it's painful or hard, but upon continued massage, it yields comfort. And so this is sort of a little bit of what we could call like an instantiation of the formula itself, right? Because the formula is a mix of both draining or clearing herbs and then supplementing herbs, right? You have both rensen and ganjiang, gancao, but then you also have huanglian, huangxin. So it gives you it it's a way of sort of it's a sort of an instantiation of that, right? Because when you first press down, you're feeling sort of a repletion. But then as you move through it, almost like you're using like this like in the same way that Banxia Xixing uses maybe Banxia and Huanglian, this like acrid and bitter draining and effusing to open up the area, it begins to feel not better. It feels nice after a while. So this is not theoretical. He actually has amassed this experience from his from his clinical practice, and eventually it sort of turns into what you would almost assume is like a not a replete but a deficient scenario, right? Where someone actually feels comfort upon massage, right? That's one of the signs of of a deficient condition or pattern.
Can I just say it's kind of interesting because
Mm.
we hear things of like true heat, false cold, but this is kind of
Mm.
almost like false excess, true vacuity is kind of like what I think it feels like you're saying a little bit.
There's layers to it. Um, yeah. There are people that say, in the Kampo tradition, they say that um, glomus is actually a Ren-shen pattern. So Li Zhongtang could also have glomus, because basically there's not enough qi to move out from basically the middle burner out to the exterior, to the upper burner. So it gets caught there. Now, the area, he says the area might also lack springiness, which is like a Ren-shen sign. So again, this is a Kampo idea that um, the sort of the substernal sign has to do with Ren-shen. Glomus vomiting or borborygmus. So borborygmus, I think, is like a really one of the things you hear very specifically in Banxia Xixing, or in the Xixing Tang formulas. I don't know if we hear that outside of Xixing Tang formulas, laming. But you can check me on that. Now, the other thing he says is the patient should not be overly deficient, because eventually this is a um, mixed pattern. It's not a pure deficient pattern, right? And so in his experience, in the Campo experience, that's what they say. Now, poorly formed stools, or some formed, some unformed, right? Sometimes you hear people saying that, like in a Banxia pattern, you get that some formed, some unformed, as sort of this, again, it's sort of an instantiation of the fact that you have this mixed heat cold pattern, essentially.
Can I just,
Now,
sorry, I got
yeah,
one more question. With that,
mm,
do they say that sometimes it might be during the same bowel movement or different, or
yeah,
at different? Yeah, okay. So it can sometimes start formed and then become a little bit loose. You might not have a formed bowel movement, then a couple of hours like loose. It might,
could be
No,
either,
th
I
could
think.
be either,
they'll
either.
they'll say that in the same bowel movement it comes hard, and then as you launch those pieces,
Hmm.
it comes out like loose. That
Follows. Yep.
because the hard is at the yamming, the loose is the tying.
Yep. 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 Yep.
Now, Ouyang Weiquan, actually, just to add another thing, is that he says he finds water splash sound can take, well, I haven't experienced that, but Ouyang Weiquan is another big guy for formula pattern correspondence, so I thought it's not bad to bring that up. Of course, another thing also is like Banxia lines on the tongue, right? Which I'm surprised that he doesn't bring up, but just the two lines down either side of the tongue is a very clear, often a clear sign. Huang Huang calls those Banxia lines, right?
Mhm.
Now, lastly is the Dunine, which we already covered, right? Now, in terms of the Gancao Xixing Tang pattern, this is once you've sort of determined, okay, this might be a Xixing Tang pattern from the above things, we can start to look a little bit deeper into differentiating between like a Shengjiang Xixing Tang, Banxia Xixing Tang, or Gancao Xixing Tang. Now, um, for Gancao Xixing Tang, from the line itself, we know that there's diarrhea, maybe dry heaving, borborygmus, vexation, glomus, and then this from the jingfang, we also know that there could be like skin ulcers, right, in the mucous membrane. Now, Ouyang Weiquan will say that there should be more pronounced diarrhea and deficiency, while also displaying psych symptoms like anxiety, right? So that you get that from the line itself, it says, right, there's vexation or anxiety. Now, Ken Fujihara, who's like a Kampo guy, he says it should have the most pronounced glomus of the Sissing tongues, which we sort of also get from the fact that they not only say there's glomus, there's fullness, and there could be hardness as well. Now, I don't know if you guys have anything to add in terms of understanding the Gancao Xie Tang pattern. Um, Otherwise, I can just go on to some ideas from Pulse about the pattern. For Xie Tang formulas in terms of Chen Jianguo's ideas, uh, Xie Tang, he believes you should really read on the right guan, and he has a difficult way of characterizing which is he said it's basically the overall pulse feels uh it feels deficient, but the most within those deficient pulses, the strongest pulse he thinks will be on the right guan. And then he says it'll be a short pulse. It'll be very sort of confined on that right guan. So that's his idea for Bansha Xie Tang. Now, Gancao Xie Tang, he will additionally say that you might also see a thinner left pulse. And maybe even to a degree, you might see a roll up on the left side. So this has to do with Gancao and the idea Gancao sort of supplements blood and yin, which Chen Zhenguo identifies with the left side.
It doesn't seem
Now,
too much of a string like, because that's a wiry, which is what this case had, right? He doesn't look too much
yeah, but I wouldn't like read too much into Lou Shao-kun
pulse style.
his
More,
pulse stuff. Yeah, because
yeah, yeah.
he's not a serious pulse taker.
Yep. You take his kind of abdomen stuff as the forefront of his kind of.
Well, and they're also a little bit like they think pulse is like made up or something. They're not very into pulse because again, that's sort of like coming from a compo perspective.
They want those kind of
Um,
objective signs and symptoms.
yeah, he quotes someone, I forget who, just saying, abdominal palpation is sort of more reliable essentially than pulse. The main reason being that he thinks that pulse is too like mediated by theory. So anyways, Shruqi, who is another pulse guy, jingfang pulse guy, um, he says that you will see a wiry pulse on both guans. Okay, so a little bit different than Chen Jianguo, but also I think Chen Jianguo would also say that the left guan would be notable. It wouldn't be as notable as the right guan. And then he also says that I think if I understand him correctly, basically, if you compare the left and right sides, um, the two cuns will have a different quality. The two guans will also have a different quality, and the two ci will have a different quality. And that's a
Sorry, Will,
characteristic
we
of
just lost you
Jueyin
for a moment. Sorry, Will,
formulas.
can you just repeat what you
So
said?
that's
We lost you for a moment when you just said they wouldn't have equal sides. Can you just please repeat what you said?
did you hear? Yeah, cun guan ci on both sides they'll be different, right?
Yeah, we heard
Cun
that. Then
the
we lost you.
okay. He says that's a characteristic of Jueyin formulas. Okay, so he's categorizing Ganqiao Xixin Tang as a Jueyin formula, which is also Hu Xishu, I think sometimes doesn't he characterize it as Jueyin? Basically, heat above, cold below, essentially being a Jueyin. Um, all right, so that's just to summarize, clearly in this case, all that we're looking at is just the formula pattern. We're not concerned with the specifics of her infertility. Obviously, in some cases, he does give a little bit more credence to that, but he's not targeting it. He's just saying uh, the whole body is involved in this formula pattern. So as you work through this formula pattern, which is like the primary contradiction, the primary issue, then the whole body will start to change, right? Now, this one we'll see is a little bit more of a classic formula. And again, feel free to guess and sharpen your skills here as we go. So this is infertility with amenorrhea. This is a 32-year-old female, also in the 80s, and she failed to conceive in 5 years of marriage. Her first period came at 18, and she subsequently had delayed menstruation, with periods only coming every 3 or 4 months. In the past 8 months, she developed amenorrhea, and she was found to have a monophasic basal temperature. And I think everyone probably understands it's a monophasic basal temperature. That means that she's failing to ovulate essentially. She's failing to get that increase in temperature at ovulation. Now the patient has a pale dark complexion and complains of pain and cold in the lower abdomen, aversion to cold, cold limbs, dry lips, cracked palms, cold hands and feet, sloppy stools, and copious and transparent leukorrhea. Now the pulse, he says, is sunken and tight. The tongue is dark and pale with a thick white greasy coating. In the abdominal palpation, he notes there's fullness and distension in lower abdomen that is soft and lacks springiness. And he said no binds can be palpated. So on channel, again, he's doing channel palpation, which is something he tends to do for a lot of diseases, especially in fertility. He found pain upon pressing at do2. So this he's going to diagnose as a Jiayin disease, liver channel qi and blood stagnation, and deficient yang qi diffusion. Now, sorry, I already gave it away, but hopefully you're already guessing there. The formula uses is Wenjing Tang. So again, you can see the doses are not particularly high, especially if you look at Wuzhu, you only use 1.5 grams. And it's sort of fairly balanced. I guess the highest dose goes to Dangshen. It's kind of interesting. And then he says, additionally, I wet cupped at do2 every second week.
Can I just
Remember,
ask,
that's, yeah,
is there any difference between Chuan Tiong and Chuan Xiong?
no. It's the way of writing it.
Just okay, yep, cool, thank you.
Yeah. After 50 days of treatment, she developed biphasic basal body temperature and showed signs of ovulation. She continued taking this formula and getting wet cupping and ultimately conceived successfully. So you can see that's a nice case because in some ways, you might be quick to say, it's a very deficient presentation in a lot of ways, and you'd say, this is just kidney yin and yang deficiency or something like that, right? From a like a post-classical perspective. And they need to target like the kidney essentially, but you see here there's not really any of that being done, and so but it still has a good result. Now he sees Wenjing Tang as a modification of Dangui Sini Tang plus Wuzhu Yu Sengjiang, which I think that's a pretty cool way of looking at it. I think it's a little tricky because Mai Mendong is actually very highly dosed in the original Wenjing Tang. And also Dazao is also very highly dosed. But besides that, I think it's a nice way of looking at the formula. It says in amenorrhea, one can often find sensitive spots in the lumbosacral region, especially at do2, do3, and below the fifth lumbar vertebrae at XB8. Wet cupping at these points will greatly improve the efficaciousness or the efficacy, I don't know, I chose that word, of treatment. So that's a nice thing also in his case studies that I quite like, is this combination of using either bleeding or some sort of, we call like an external kind of treatment. A lot of acupuncture as well. And he seems to think that that really helps along the treatment. And yeah, so are there any questions at all on that case?
Can
Or
I?
yeah,
Does he do like he's felt along the do channel on both of these
yeah,
cases, and then
mm,
on the second one he did wet cupping. If you've
yeah.
looked at any of his other cases, does he do much other kind of what you might say like more standard acupuncture treatment or moxa for any of his other
Sure,
cases?
sure. Yeah, he does a lot of moxa. Yeah, he also
Yep.
instructs patients to do moxa. You'll see in a lot of cases.
And
Acupuncture as well. Yeah, for sure. Yeah, but he does seem to do a fair amount of bleeding
yep.
is something that he does quite a bit of. Yeah. Um, so, just read the book and find out. A
It's
lot of
coming out
good
soon,
cases
right?
in the yeah. In women, so let's go into Wenjing Tang now and look at how he's grasping at this formula pattern. So he says in women 50 years of age, this is from the Shangan or sorry, the Jingguo Yaolue.
In the
When
miscellaneous women's chapter, I think, right?
right, yeah. In women 50 years of age, when there's diarrhea 10 plus times per day, tidal heat at dusk, urgency in the lower abdomen, abdominal fullness, vexation in the palms, dry lips, and dry mouth. What is the cause? This is because the patient had a miscarriage previously and blood stagnated in the lower abdomen. One can check the dryness of their lips to see if they suffer from this condition. It's also indicated for coldness in the lower abdomen with infertility or advanced delayed menstruation. So for this reason, this formula, it's really a formula that's very popular, or something that should come to mind quite easily, I think, in the treatment of infertility. Obviously, if the pattern matches, right? So because it literally says it's indicated for coldness in the lower abdomen with infertility, or a delayed menstruation.
Well, it's interesting because I
Mm,
think like in at least in the book, like a lot of people think of it as a menopausal formula, being the 50 years,
right,
right?
right, yeah,
Which is kind of
yeah,
you and you go back to the Suan, like the 7 times 7 is 49. But it's interesting
mm,
here to then see that like, that they've obviously found new uses, which is what, you know, in Chinese medicine, there's no doubt that they continually find new uses for different formulas, but it's interesting here to see that then being used like that. Yeah.
well, it should be in the Jingguo Yaoyue itself, isn't it?
Yeah.
But it's not in the proper line as the thing. It's
Yeah.
sort of tucked in below.
Yeah. Yeah. True.
Um, so I think people kind of overlooked it a lot of the time.
Yeah.
But it is obviously, it makes sense, right? If you look in the herbs in there, it makes a lot of sense. Why would you would use it? And so, if you look at, we're going to look at some of the formula pattern for Wenjing Tang now. And this is because Wenjing Tang, I think, it's such a big formula, right? Um, this is actually, I think it's missing Baisao. Wenjing Tang also had Baisao, but there's a lot of herbs in there, so it's sort of like, how do I know when to use this formula? It's so big, um, and it does so many different things, right? Maybe you could say it supplements yin, maybe it moves blood, supplements qi, supplements blood. It also has wuzhuyu, right? Usually at a big dose, and this time not. Um, so this is coming from Huang Huang, who says the constitution is frail with a pallid or anemic complexion, often, not always, right? Aversion to cold, unformed stools, frequent and copious urination. Um, because you have obviously, if we look at it as a Dangui Sini Tang plus Shengjiang Wuyu, sorry, Dangui Sini plus Shengjiang Wuyu Tang formula, right? If you'll recall from that formula, it says, um, if there is long-term, long-standing cold, then add Shengjiang and Wuzhuyu. So we know that this person they should have signs, right, of long-standing cold, right? So that would be, of course, aversion to cold, unformed stools, obviously frequent copious urination. But then you also have this blood stagnation and maybe to a degree also a blood deficiency, but maybe they're also interlinked, right? And so there's often cracking, dryness of skin, macules on the face, dry hair, or hair loss, cold in hands and feet. Importantly, again, we're talking about this long-standing cold, right? There could be an engorged, scalped, and tender tongue, right? So especially you think of Wu Zhuyu, right, in Shengjiang, they're very strong movers of this cold room or this stagnant cold fluid in the body, right? And so that would make sense for the tongue. Now, the palm and foot sole heat, dry lips, dust tidal heat are typically also signs of blood stagnation, per Huang Huang. Now, in terms of fukushin or the abdominal pattern, right, abdominal diagnosis, there's a very specific pattern here that I think is worthwhile for people to take a look at and try to confirm in clinic. Now that's abdominal fullness. So over the entire abdomen, there might be fullness. Now fullness, another word that might be good, especially I think in this case, although they do say full, but I think would be distension, which we associate with a taiyin cold scenario, zang. We don't say man. Man can also connote a Yangming disease. So that zang sort of distension, I think, is also good for the abdomen. Now, there's going to be tightness, he says, in the rectus abdominis, which is often a sign of cold, right? Now, the lower abdomen is going to be soft, so the lower abdomen refers to below the navel, right? And lacks springiness. And this is important, no binds can be palpated. If there's binds, then we're getting into Taoren territory, Taoren Honghua. These other stronger blood-moving herbs. Okay, so if there's binds, maybe we're getting into Guizhi Fuling Wan, Tao Chengxi Tang. Interestingly, Danggui Xiaoyasan sometimes also has binds felt around the navel. Okay, and so they call this Donglong Fu, which is like a lantern abdomen. Now, what does that mean? Donglong Fu or lantern abdomen. It means that sort of when you press on it, it feels tight, but then if you apply any pressure to it, it feels soft underneath. And so this is what Huang Huang or in Kampo tradition might be thought of as like a guizhitang. We might see this in a guizhitang pattern as well. And of course, there is the guizhitang pattern embedded within the Wenjing Tang. So it kind of makes sense. So these are things to look at because it is, I would say, a fairly distinctive abdominal pattern, especially the fact that you can't find binds, right? Sometimes. And also the softness of the lower abdomen and lack of springiness, but the tightness in the rectus abdominis. Okay, so yeah.
Can I just ask, perhaps for people who aren't so familiar with it, and a little bit myself, is that when you're talking about binds, are you talking about like a palpable mass, or is there like a tightness? How would you describe a bind for someone who isn't so familiar with it?
Well, I mean, it's sort of, for instance, like you might think of a bind like if you ever massage someone's shoulder or someone's neck, right? And they got a little caught, the fascia is caught up in that area and it's not smooth, right? As you feel along the muscle, there's a bind there.
Yep.
So
That's a good way to describe it, I think.
I don't think it's like you wouldn't want to, I wouldn't think a mass I think that would be a different kind of thing. But I don't
Yeah.
know if Ivan has any other ideas on that.
I mean, it's interesting because, Zhang Zhongjing, like the line before the Wenjing Tang of the woman's 50 years old and it does the diarrhea and all that, like the line before, he talks about like the three causes of miscellaneous woman disorders. And he
Mm,
says the three causes are uh, vacuity, accumulated cold, and then
mm,
knotted chi, right? So I think more a mass like the conglomerations, concretion conglomerations, all that, that'll be more in the of an accumulation. So the accumulation of
mm,
cold accumulation, and
mm, mm.
not at cheese. So it's like he's differentiating like Zhang Zhongjing, like well, there he differentiate cold and not at chi. That's more like chi versus blood, right?
Mm.
Oh, okay. Yeah, that's a good point. Yeah, yeah, yeah.
So now Wenjin Tang seems to, I don't know, treat the good amount of those three patterns.
Yeah.
So, and even you look
Yeah,
at his
it's
diagnosis, there was like the blood stagnation, right? I think like what a little bit
yeah.
of like and saying it was like a Dre Yin disease or a bit of cold. So it is you're kind of right that it does. It's almost like they have each of these things, but this is kind of like a broad spectrum for when people come in with quite a mixed pattern.
Mm, mm. I think a lot of it is based upon the I think it's based upon the guizi being the base of it. But yeah, I mean this is pretty consistent. I mean, if you look at Huang Huang, how he describes it, or you look at if you look at Lou Shao-kun, he also tends to describe it this way. So for me, I'm not that experienced in fukushin as of now, so I just go with what they say because I'm still trying to learn. But it is worthwhile to try to analyze where these ideas come from to a degree, I think. Um, Now, in terms of the pulse, um, again, this is I'll give two different pulses. One comes from Shuruchi and one comes from Chen Jianguo. Now, Chen Jianguo tends to say that this will have what we call that sort of classic pulse that shows up again and again, which is double roll up and then double guan pulse. So the double roll up is obvious. Now the double guan, um, he'll often find like a rough pulse on the left side. He won't really, so again, talking blood stagnation here. And so he won't really use this formula unless he feels that rough pulse on the left guan. Yeah.
I'm just gonna say sometimes people also translate it as choppy.
Oh, choppy. Okay.
Rough or choppy, but rough is the Wiseman term, but choppy is also a common term in case people aren't familiar.
Mm,
That it means the same thing, choppy or rough.
mm. So that's what he would look for in terms of that. And then, it's a little bit similar with Shuqi. Shuqi doesn't seem to pay attention to the roll-up pulse too much, which is too bad. But he says that the Guan pulses will, again, he says a lot of what is happening is on the Guan pulse. So he says it'll be wiry and thin, right? So again, maybe looking more at that uh, perhaps the blood deficient aspect of it. The wiry is interesting. Uh, wiry can be rheum, it can be obviously cheese stagnation, it can be a pain. Uh, so maybe to a degree, because we have Wuzhuyu, right? Um, it could be related to that, the rheum aspect. But also, I think it has to do with the fact that he thinks this is, again, a Dreyen formula. So for Dreyen formulas, we might expect, he thinks, a wiry pulse. Now, again, he thinks that Dreyen formulas often have that characteristic of the left and right at each position being a bit different. And so when he sees that, he's immediately going into thinking about drain formulas. So another thing to think about. So these are all ways that we can identify a Wenjing Tang formula pattern, beyond just thinking about, what Lou Shao-kun says, this, these etiologies and disease. It's at the level of the patient themselves, right? Which is what he's really trying to focus on in the treatment of miscellaneous disease. So shall we move on? No other questions? So now what we're going to do is have a little bit of just a tiny overview. We're going to try to drive home some ideas, especially from Lou Shao-kun in this particular video on infertility and the treatment of infertility. I think my videos will primarily focus on infertility, just so we get a fair amount of people treat that, something that people are interested in. And I think what's nice is a lot of the time, be it in the mainstream discourse or in school, we do get a etiology or mechanism based approach. And so here we can get a jingfang approach and try to start thinking about it from a jingfang perspective, which I also think is quite useful. So as we said before, he says he thinks physicians often fail at treating infertility precisely because they are over-focused on sort of a mechanistic, their treatment stemming from a mechanistic understanding of the disease, whereas oftentimes their primary contradiction is somewhere else. So there could be all kinds of etiologies in infertility, right? Anything that's causing some sort of blockage below could obviously lead to infertility. So phlegm, heat, cold, blood stagnation, rheum, qi stagnation, deficiency, right? All these things could contribute to that. Now, the thing with jingfang is it takes a step back to look at the whole organism and say, what is really going on with this person? Where's the block? Where's the primary contradiction? And so, for instance, in the first case, when we have Gansao Xixing Tang, we might say, what does that have to do with infertility, right? But if you think about it, it does have some relation, because basically Xixing Tang formulas, they constitute basically this blockage in the middle burner, right? In the substernum. And what happens as a result, right, is that you don't get this exchange of heat and cold. And so heat remains above, cold is below. So obviously, if you can't get this heat going down, right, you're not getting that yang qi going down into the lower burner. That's going to affect your ability to get pregnant, right? And if you were to just use, for instance, you say, well, so this person has cold below, then let's hit him with some yang supplementing formulas. Well, then you've missed the primary contradiction in the situation, right? Which is that you have to open up this block, and the yang formula probably won't do that, to probably exacerbate the condition. Now, in the second case with Wenjing Tang, is a complex situation, right? Oftentimes, if we think about it from the perspective of Dangui Sini Tang plus Wuzhu Yu Sengjiang, a lot of what's gone on is you have long-standing cold that then leads to basically the inability of blood to flow throughout the body. You get this blood stagnation. Now, as a result of this, you also you have this sort of, maybe to a degree, in repletion below. You also have this heat above. Is another component of Wenjing Tang, right? That's why you have this big dose of Maimendong. And so that's also contributing to scorching blood and causing blood deficiency, right? So again, if you just tried to treat the blood stagnation, if you just went for you know, one of these Tang formulas, you might not fare so well because there's also this cold component, right? There's all this heat above component, all these other things going on. So this is why it's so important. I think jingfang is so powerful in the treatment of infertility because it's looking at that, how to resolve the entire condition, right, of the person. So you might see, for instance, some accumulation of blood or cold or room below due to exterior contraction. That's also very common. You can think about Wuling-san or think about Tang, which are both these have this exterior component, which then ultimately leads to amassment of room or blood below, right? So that's one thing. Cold below due to taxation, right? Because you have this chi moving outwards, and so again, the below is cold. So these are things that are special to jingfang, I think. Now let's finally look, I think, at some common formulas. As Ivan says, I like what he says. It's good to have a bank of formulas when you're looking to when you have a patient coming into your clinic, right? If you have that bank of formulas, you feel a little bit more confident, and you're likely to, you can catch the pattern that much easier. Now, the way I organize this is in terms of the 6 confirmations. It's not the only way you could organize it, but it's a convenient way to organize it. So, and it also shows you that really all 6 confirmations could contain patterns that would lead to infertility. So for Taiyang, I said, I think a very important one is Gugan Tang. This is one that Chen Jianguo uses quite often in all of his gynecological issues. Now, the main point, and I think I've talked about this before, obviously, is that there should be some sort of problem in the left shi, a tightness in the left shi, and a sort of a repletion, a stronger pulse. If you want to use it, that's one aspect of it, right? Obviously, you also want maybe a roll up on the left side or strong cun, floating cun, tight. But and some schools also say you can have right cun or right roll up. In those situations with the left chi, he's using chaige, right? He's not using fenge, which is another kind of gugun. And then of course Wuling-san is another one that we just discussed. Now in Taiyang Yangming, this is also very interesting. So for Huang Huang, one formula he ends up using quite a bit is Jingjie Lian Qiao Tang. Now this formula, he says he uses in cases where there's inflammatory conditions occurring in the pelvis, in the uterus. Okay. And so that's something that we can look at. It's like Sanhuang Xie Tang plus Siwu Tang plus a few other herbs. Gugan Qinlian Tang is sort of this similar idea. It's nice because it also has that gugun, which again, if we see that left shi issue, we can then pivot to using chaige. It hits the lower burner a little bit more. Tao Chengqi Tang, obviously we just talked about, and then last but not least, Fang Feng Tongsheng San, another popular herb in the Campo tradition, which also is used quite a bit by Huang Huang. And this formula has a little bit of everything, right? It has, I think, Dahua Mangxiao. So for basically a replete Yangmin situation, but then it also has a range of exterior releasing herbs at the same time. So it shows that's, if you see that sort of, and then I'll just give a little note on Fang Feng Tongsheng San, which is that for Lou Shao-kun, he says for the abdominal pattern, he often sees umbilical tightness and rigidity. That's what he feels. And then in the context of a full and replete abdomen overall, that's a sign he looks for, 方方同上散. Yeah, I mean, some of these are from Lou Shao-kun's book. So for instance, he has a case using Zhuling-san, which we can imagine, is basically this, just like we had this room amassment, then you have this basically damp heat obviously can cause all kinds of problems in the lower jiao, so that's not that hard to imagine. Now Shaoyang is even easier to imagine, right? Shaoyang, we know, for instance, Xiao you get a cold on your period, this goes into the causes the what's it called, the evil to go into the uterus, right? So Xiao is obviously deeply implicated in treating the uterus in general, right? 柴胡桂枝干姜汤, Huang Tang, any of them, Da Shai Wu Tang, right? 柴胡 Jialonggu, they could all be used. Now, Taiyin, I think Wuji-san is a good one to mention. Wuji-san, right? Because this is a formula that actually comes from the Song Dynasty, I believe. And it's a little bit later, right? But oftentimes still espoused by Kampo school. And Wuji-san is it's like a phlegm formula. It's tie-in phlegm room formula. It's got Archan Tang inside of it. It's got Pingwei-san. It's got Lingwei Zhugan Tang. But then on top of that, I think it has certain exterior releasing herbs at the same time. So you could almost call it a Taiyang tie-in pattern. But again, very nice formula again for this sort of phlegm type person, or this phlegm room congestion in the lower jiao. Shaoyin, of course, these are also taken again from Lou Shao-kun, his book. He uses Zhengwu Tang, for instance, Dang Fu Zi Xixing Tang, Jingui Shen Qi Wan. And then for Jin, we just talked about Wenjing Tang, and of course also Dangui Sini Tang, right? And of course, I'm not sure where to categorize Dangui Shao-san, but it's obviously also one that's used quite often. So that's just a little overview. Obviously, there are many more formulas that can be used in infertility, but yeah, just to give you a sense of the breadth, right? And to not be limited to whatever the textbooks teach, right? So I don't know if anyone has any other formulas that they would like to talk about in the context of infertility.
Not too much from me, but I've studied more of Professor Huang, but he definitely has that idea of kind of like person disease formula, which you can kind of very much see, I think, similar to Lou Shao-kun, right? Where,
Yeah.
And one of the things when I spend a bit of time in Professor Huang's clinic, I think he really also tries to get the person, like, not so much treating infertility, but really trying to make sure the person is like in the prime state to become pregnant, right? So it's kind of like whether that means like regulating their sleep or the digestion, or even just like, and I even remember Stephen Clavey saying as well that he would really just try to make sure that the woman was having a good period first. That would be like, because if they weren't having a good period, then he would, like, very difficult, like there's something wrong there as well, regardless of if it's like Ren Chong or anything like that, making sure that they have a good period kind of each month.
Right.
And then that, the rest of the things, like, that they don't have like too much diarrhea or, other problems, things like that. They're really trying to make sure that the woman, when she gets pregnant, is in the kind of prime condition for having a good pregnancy as well.
Definitely. Yeah, just sort of almost improving the constitution, right? Because Huang Huang has constitutional formulas, and sometimes he'll just purely target constitution, even over a pattern to a degree. It makes sense, yeah. That's pretty common, I would say, like using the period as like a target. also his colleague there in Nanjing, Xiaogui is also, he's the most famous gynecologist, maybe him and Zhao Songchen. Um, they both have that idea of targeting the period, making sure it's regular. But I would say Lou Shao-kun doesn't care so much about that. I think his thing is just targeting patterns and resolving one after another until the person's better. Which in a way, I mean, it takes the pressure off a little bit. I mean, obviously it's difficult because you have to identify the right pattern, but you don't have to think so much about all the mechanisms and all this stuff, right?
Well, what's interesting about that is that even within the kind of jing-fang school, you see kind of
Mm,
maybe two slightly different approaches there as well. And then,
right, yeah.
you have the other kind of disease approach and things like that, which is also
Yeah.
outside of this one as well. So it's kind of interesting to see once again, and that's always the aspect that I love about these kinds of discussions is that we get to see different ideas because
Mm,
I think most people in clinic will have unsuccessful infertility cases where maybe they might treat it like this and then maybe decide, okay, maybe I'll try to treat the disease rather than treat the person. So it's always
mm,
like once like you said, good to have these kind of different
right,
approaches that you might be able to use in
exactly.
case one fails.
Yeah, definitely. Yeah. I mean, not to keep plugging the book, but it's a book on case studies and medical treatises. And so he spends a lot of time in the medical treatise section talking about the what he calls the mechanism school or the inner canon school, and talking about comparing it to jingfang, comparing, Liu Duzhou and who's the other guy? There's one other guy, and versus Hu Xishu and Huang Huang. And
Mm.
it's interesting. Yeah, he's a very opinionated guy on that one.
If I can, I'm sure Ivan has something to say something in a moment, but I just want to
Mm,
say that that is actually when you're talking about the kind of medical treatise or sometimes like this kind of
mm,
like medical theory ideas as well, is that's
mm,
almost like one aspect of literature that is almost completely missing in English. That there is a
mm.
lot of in Chinese, that we have kind of
Right,
like
yeah.
books on case studies, we have books on Shang Lun, but no one's ever
Mm,
really taken the time to translate a doctor's medical treatise kind of theories. Like even like
mm.
Professor Huang Huang's books are all generally about
Right.
clinical practice, whether it be the 50 clinical herbs or his clinical handbook or the 10 key formulas.
Yeah.
And but
He
like
has a
no
book of treatises too. I have it. Yeah,
What
but
about
Yinhua, right.
Chinbo Wei's ontology?
well he that but doesn't he just do oh no you're right. I was thinking of the 50 treatments. They have the other one,
No, no,
but
no,
that one's out of
ontology.
print. That one's out of
Yeah.
print. So
I
I
mean, I
I
got it. I
actually
got it.
I actually haven't seen that one in English. I've seen all his stuff in
It's nice. It's
Chinese.
nice. It's nice.
Yeah, so that I mean maybe we
Who
gotta
translated that?
Chip Chase was it,
Yeah, I think it was Chip
and maybe
Chase. Yeah.
someone else.
Oh. Mm,
Um,
I think it was
but
just Chip Chase.
okay, but I mean like yeah, that would be a really
The
wow.
cool
other
one
one
to have
was
a.
Jason
Respect.
Blalak.
Yeah, he did the 50 methods with, and his teacher Wu
Mm,
Ping, the or
Wu Bo
Chimbo Wei
Ping.
student Wu Bo Ping. Yeah, yeah, yeah. But I can't really think of too many other books, or at least besides that one that would discuss like medical treaties. But
mm,
so I
mm.
think that's gonna be a great addition because you know
Yeah.
like just having
It is,
cases.
yeah.
And that's kind of a little bit of what I think we even do with here is like we kind of like talk about the case and when we have a little bit of kind of like this theoretical treatise discussion as well. So it's kind of
Mm,
like
mm.
we're kind of like doing these combinations here because I think if you just look at a case, it can be good, but it's so much more illuminating if you understand the deeper aspects of it.
Yeah, and it's cool too because you see sort of some of the intellects these guys had. I mean, this guy was very well read. He's quoting left and right, and I think gives you a deeper sense of who they are as practitioners and people.
Well, it's also quite humbling, I think, when you think
Mm,
like, damn, you got to work hard to, be a
yeah,
top guy.
definitely. Yeah. Yeah.
So, sorry, Ivan, I spoke a bit. Did you have anything to say?
No, one thing to consider though, in terms of administrating formulas to infertility patients, and I don't have an answer here, but it's a very important clinical scenario that a lot of infertility patients that do come into clinic, at least here, is they're already getting treated through IVF.
Right. Yeah.
So the conundrum will be, can you administer oral formulas during that process of IVF? I know before you
Mm,
could and after you could, but during that process, and I don't fully understand IVF complexities all the myself completely.
mm, mm,
The extraction and the and the insertion and all that, right? Of the egg and all that. Um,
mm.
so the idea is some people will say, well, the formulas mess because during the IVF, women are also being basically manipulated the hormones
Right.
with
Yeah.
estrogen, progesterone, and these formulas are also doing that.
Mm.
So the thing is, are we affecting the IVF success or not uh, during the administration? I don't have an answer for that. I
Mm.
myself will be cautious because IVF is expensive.
Right.
Uh, to not mess with it when they're being at that delicate time period. I wouldn't administer
Yeah.
a formula right then, but I will administer the formula until then, until get them ready for that IVF.
Mm. Mm. That
Because
makes sense.
you
Yeah.
don't want to get liable for that, I think, you
Right.
know.
Yeah. A lot of money on the line there. Yeah. Yeah.
Mm. Yep. I mean,
And
in
but
a
it's also important to say that IVF, I read a statistic that when you're turn, I think, past 40, it only has like a 15% chance of working or something. It's not a really high chance.
Mm. Mm.
So even though it's the golden standard, it's not really that high.
Yeah. I mean, there's only so much you can do, right?
well,
To try to cheat nature.
well, 40
Yeah.
is quite late to be
Yeah.
attempting pregnancy. Um,
Right.
Unfortunately,
You can always
it's
give it a shot.
yeah. Well, I mean, that's what IVF does. It
Don't want to
can give it a
discourage.
shot. I mean,
I think I saw a story about a Chinese woman who got pregnant at like
Oh, yes,
70
I
or
think,
something
yeah.
recently.
But
So you never
Chinese
know.
Chinese medicine, there is a little bit of cheating of nature, like all these
Mm,
stories about men turning their hair black, conceiving. I
right.
don't think even Sue in chapter one is like the idea between those who waste their essence and don't waste their essence
Mm,
are able to conceive later on. Or I think they say you could still have a child for a while, you know?
right.
So I
I
think Chinese
guess,
medicine,
yeah.
there is an aspect of cheating nature by
mm,
understanding nature.
mm.
Mm, mm-hmm. Mm-hmm.
But yeah,
So yeah, it's a bit of a different, this is what we would call, this is almost what Lou Shao-kun himself calls formula pattern orthodoxy. That's the term I gave for it. I kind of forgot what the
mm,
Chinese was, where you're just laying it all on the line, sort of for formula pattern. You're not thinking at all. And this is something that he said comes from Yumoto Kyushin, and his total casting Neijing theory to the side. And so it's like Michael says, it's just it's one approach, right? It's not always going to work. Lo Shaokun also says, in some certain cases, maybe you got to think about mechanism because maybe something is being sort of covered over by the symptoms or some there's something that you're not catching, and as a result, you're not getting the correct symptom pattern, right? So obviously, just another tool to have in the belt. But I think that yeah, that's all for me in terms of this particular uh
thank you.
section. Yeah.
Oh, cool. Thank you very much. That was, I think, yeah, quite an interesting take, and I think probably, how do you say, like a little bit out of left field for people who might have studied other infertility methods.
Mm,
To really think, oh wow, I just don't have to like focus on the uterus and the period. There's I can look at the person too. So I think that, and I think that's a really kind of like, it's always a good reminder to look at the kind of, different perspectives. So thank you very much, Will.
Definitely. All right, well, on to the next one.